and we're going to say hello to Gretchen Hawley. Gretchen, so now I'm going to introduce you. Firstly, thank you for being here. Thank you for doing all that you're doing. For those that don't know Gretchen Hawley, she is doing our physical therapy wellness program as part of our wellness series that's on every Monday night, I think, of the month. We either have Gretchen doing physical therapy, or we have Pilates, or we also have yoga. It's called Wellness Mondays, okay? I think we're calling it Wellness Mondays, or Moving with MS Mondays. Either way, that's, the topics, and Gretchen's been part of this for a long time. So Dr. Gretchen will share updates on the effective exercise for multiple sclerosis patients. Plus, she does live demonstrations. She's got some techniques to share, tips on improving movement, strength, coordination, and balance. Gretchen's going to speak for 35 minutes, and we will then do Q&A with Gretchen. Okay, I want to thank everybody.
Awesome. Thank you so much. And thank you so much for having me on with your annual symposium today. I love talking about this topic of movement and wellness and physical therapy, how those all integrate and how you can best use these strategies to actually help improve your mobility, because there are some things that are less effective. So what we're going to be talking about today first is neuroplasticity. I start every presentation talking about neuroplasticity because it is so important. Then we're going to get into MS-specific physical therapy, followed by wellness versus function, and also newest guidelines. So by the end of our presentation and our talk today, you should have some tangible things that you can start doing today if you wanted to improve your walking, your balance, your coordination, flexibility, all that good stuff. So moving on to the next slide, neuroplasticity. Neuroplasticity is the reason that someone with MS actually can improve your strength, your balance, your walking, and without neuroplasticity, someone with MS wouldn't be able to regain those things. So if you look at this picture, you'll see that in order for a muscle to work, first, our brain either has to have the thought of, Dr. Gretchen, bend your elbow. And then it travels down the neural pathway, and then it gets to the muscle, and I bend my elbow. Now, of course, this happens in like a fraction of a second, but that is typically the way that this works. The only other way that you can move a muscle is if you have a reflex, like you touch something hot and you bend your elbow, or something of that sort. You step on something, you have to quickly move. So you start with your brain, you move down the neural pathway, and then you are activating the muscle. So with MS, as you all know, the issue is in that middle portion where that nerve is. So basically, your brain might have the thought of, Dr. Gretchen, bend your elbow, but then either the neural pathway is just so demyelinated that it only gets a fraction of the way, the message doesn't get all the way to my elbow, and then I can't bend my elbow at all. Or that pathway is there, but there is still some demyelination, making that pathway slow. So by the time that you actually do bend your elbow, it just feels heavy and hard to move. So that's the typical pathway that we see for any muscle, whether you're trying to bend your knee, lift your ankle, bend your elbow, literally any muscle movement. So moving on to the next slide, we are going to be getting into specific physical therapy for multiple sclerosis. If we were in person right now, I'd have you guys raise your hand and let me know who has been to an MS specialized PT versus an orthopedic PT. Regardless, something that I hear quite often is that you've been to PT, but it didn't work for you. It didn't help. And usually what that tells me is that you have been to an orthopedic or a traditional physical therapist, and they were using orthopedic or traditional physical therapy exercises, for you. And unfortunately with MS, it has to be MS specific. So there's a reason that you may have felt that it didn't work for you. So MS specific physical therapy, this is just a small list of things that it can help with. Of course, strengthening, balance, aerobic, endurance, spasticity, fatigue, depression, walking performance, quality of life. And what all of these lead to, even if just one of these improve, don't you think that you'd be a little bit more independent and your quality of life would be better? And then think maybe if 2 or 3 of them improve, you're going to notice a big difference in your life, even if they don't all improve. So moving on to the next slide, we're going to get into more specific details. So the focus of MS specialized physical therapy is functional strengthening. We're going to talk a lot about this today, but functional strengthening, which is different from traditional strengthening. We also focus on balance and walking in a functional way. Again, that's very different than what you may do where you just practice standing with your eyes closed. There's different ways to make sure that the balance that you're gaining actually results in improved walking and balance while you're walking versus, okay, I can stand with my eyes closed, but I still fall over when I'm walking to the bathroom at night. And then our other focus is neuro recovery and or compensation. So essentially what I mean by that is neuro recovery is the ability of your brain to recover the neural pathway or find a new one. So basically on that first slide when I talked about neuroplasticity, there are exercises that we can do to promote neuroplasticity. So we as a physical therapist need to try to determine, okay, is that something that is realistic for the immediate future or over the long term? And then do exercises to help promote neuroplasticity and neuro recovery, and or exercises for compensation. Because let's be honest, as I'm sure you all know, neuroplasticity has no timeline, meaning you can notice improved strength in walking. Literally, some of my missing link clients, within a week, they notice improvements. But for other people, it's 6 months or a year. So in the meantime, you need to have some strength in compensatory muscle groups so that you can still move forward, so that you can still walk. So you're not just waiting for neuroplasticity to kick in. You still have to get from point A to point B, whatever that might mean for you, the bathroom, the mailbox, wherever you're going. So MS physical therapy takes into consideration fatigue, heat intolerance, sensation, vision. Now, of course, hopefully all of you guys watching are thinking, well, yeah, that's something that I deal with, or yeah, that makes sense. But it doesn't make sense to all physical therapists. Heat intolerance is a big one. That is when your core temperature rises from anything, including exercise. So taking that into consideration while you are moving and exercising. Same with fatigue. A lot of non-MS specialized physical therapists will tell you to do 10 or do 10 times 3 sets, even if you're fatigued, even if it's poor quality, just push through. That is absolutely not what we should be doing. Same with sensation. There's things that we can do for sensation. If you can't feel your feet, well, then it's not going to make a big difference if I'm having you do foot-related exercises. We should be touching on sensation-based exercises first. So there's a lot of considerations that we use in order to help give you the most beneficial exercises. And then lastly, again, I love doing this in person, so I'd have you raise your hand, but I can't see you guys right now. But exercises that are more traditional or orthopedic are straight leg raise, clamshell, side lying leg raises, bridging. And so I'd have you raise your hand. You can still raise it just for fun if you've done those exercises in physical therapy. Those exercises aren't functional because you're lying down. So again, we'll get into functional exercise soon, but MS-specific physical therapy are functional based. So moving on to the next slide. Awesome. Wellness versus functional. So what I mean by this is that wellness-based exercises help improve general conditioning, general strength, general balance, and functional exercises help improve function or activities, the things that we do day to day. And the reason I really wanted to point this out today is because you train them differently. So wellness-based exercises are completely different than functional-based exercises. And sometimes the exercises are different, and other times it might be the same exercise, but you're doing them in a different way. It's a different number of reps and sets and how long you hold it. So there's a difference here. And one thing I want to point out is some people are just strictly working on wellness type activities. They don't care if their function improves. They just want to get stronger. Or, they don't care if their balance improves or if their walking improves. They just want to, feel like they have more tone in their muscles, for example. While other people focus exclusively on functional exercises because they do have goals of improving specific activities like walking, stair climbing, standing up from a low surface, sitting down without plopping. And then other people do both. And so I wanted to share with you that there's a time and place for both. I don't necessarily think that one is better than the other. It completely depends on your goals. I have some clients that tell me, Dr. Gretchen, I just want to get stronger. I just want to get more tone in my legs. I just want to look more muscular. So I would give them more wellness-based exercises. But then I have other clients who will say, I want to walk better. I want to climb stairs easier. I want to get into and out of my car without having to lift my leg. I want to do X, Y, and Z easier. So for those people, I'll give them more functional-based exercises. And for those that have goals of both, general strength and function, we might do a mix. So moving on to the next slide, but mainly what I wanted you to gather from this slide was there's a difference, and whichever type of exercise you do is based on your goal. So examples, as I mentioned, wellness is this general conditioning, general strength, general balance. So examples might be recumbent bicycle, bicep curls, overhead press, crunches, plank, bridges, deadlifts, clamshell. Hopefully some of these names you guys are picking up on and like, oh yeah, I know what that is. And pretty much any machine using resistance bands, dumbbells, barbells, basically like gym-based exercises, whether you did them in a gym or at home. And again, they're good exercises for wellness type goals. And so if you've done anything from this list or something that you feel is similar, you'll know, okay, when I was doing that, I wasn't necessarily working on function, I was working on general strengthening. And I just want to take 1 second to expand on the recumbent bicycle, because the recumbent bicycle actually is a functional exercise if you have a goal of bicycling outside in a recumbent position. So, but the reason I wanted to put it here is because most of my clients, at least, have a goal of walking better, and they'll come to me and initially they'll say, Dr. Gretchen, I've been to PT, doesn't work for me. And my first question back to them is, okay, well, what did you do in physical therapy? And 9 times out of 10, they'll say, I actually started with a recumbent bicycle and I could do it really well. I built myself up to doing it for 20 or 30 minutes on resistance level 5 or 6. And what I share with them is that no matter how long you're doing it or what resistance you're on, it's a great exercise for general leg strengthening and cardio exercise for sure, but it won't help with your walking. You're sitting down and you're pushing your legs this way. With walking, you're standing up and you're pushing your legs down. It's a completely different position. So our brains and nerves don't have the same carryover, meaning if you're doing an exercise sitting down, you might gain a lot of strength in a seated position, but that doesn't mean that you'll still be able to use that strength standing. So we can move on to the next slide, where I'm going to share with you some examples of functional-based exercises. There we go. So functional exercise, as a reminder, improving function or activities. So my example, and I'm actually going to step back and give you a demonstration next, but what you do to do functional exercise is you take your goal and break down the activity that you want to be easier, and then you use those movements as your exercises. So I'm going to show you an example of walking, but before I do that, think about standing up from a low surface. Of course, you can practice standing up and sitting down, and that's great, but break it down. What do you need to do in order to stand up? If you're sitting back here, the first thing you need to do is have enough core strength to sit up tall. Then you also need to be able to scoot your body forward. Then you need to shift your weight forward. You need to have enough flexibility in your inner thighs to move them apart. You need to be able to bend your knees. And that's just all positioning to get yourself in a good position to stand up. So those 5 things can be exercises that you do. If you have a difficult time bending your knees, which is a popular one, it's common for that to be challenging, then that might be one reason that you can't stand up as easy as you want to. So practice bending your knees, or any of those 5 things. If you don't have enough core strength to sit up tall unsupported and then to shift your body weight forward, core strength is something you can work on. So even though the goal is eventually to stand up stronger, these are 5 exercises that you can do to help improve that goal. So you can go on to the next slide, and I promise I'm going to demonstrate soon. There you go. Okay, so I want to demonstrate walking because I'm assuming that a lot of people watching this presentation have a goal of either walking with better quality, walking further, walking better, something related to walking. So that's what I'm going to demonstrate for you. And what I want you to notice from this picture is that the numbers at the bottom, so 0 to 60 is stance phase, meaning you have both feet on the ground in some capacity, but both feet are touching the ground. And then 60 to 100 is the swing phase, meaning 40% of your walking is on one leg. Swing phase, meaning one leg is on the ground, the other leg is swinging through. So regardless of if you are using an assistive device, whether it's trekking poles, walker, rollator, cane, whatever it is, you're still on one leg for 40%. That's almost half of your walking. So you can go ahead and stop sharing the screen. I'm going to step back and demonstrate this for you so you get a good sense on how to make walking functional exercise. So let me just scoot back here. Okay. All right, that should be a good view. You might lose my head. I'm gonna fix this. Okay, we'll go from there. You don't really need to see my head, that's okay. But what I'm gonna do is walk in this direction. So what I want you to notice is the first thing that I need to do to walk forward is shift my weight onto my front leg. The second thing is I need to bend my knee. The third thing, I need to be able to swoop my toes up. The fourth thing is bring my knee up. Then I need to straighten my knee, put my heel down, and all while that was happening, I was standing on one leg. So let me repeat that. So that's 7 different things. So in order for me to walk forward, I first need to shift my weight, bend my knee, swoop my toes up, bring my knee up, straighten my knee, put my heel down, and balance on one leg. I hope you could hear that from back there. So the reason that I share that with you is because the functional goal here is to walk better. Now, to make that an exercise, instead of just practicing walking, which you can do, by the way, that's still a good thing to do, but you now have 7 exercises that you can practice to improve your walking. So if one of those 7 things are hard for you to do, it will affect your walking. So now imagine if 2 or 3 or 4 or all 7 of those things are hard for you to do, of course it's going to affect your walking. So you can move on to the next slide. So practicing those exercises, those separate movements will help with your walking, and that's how you make something a functional exercise. So make it doable for you. As I just demonstrated, I was standing for those 7 movements. However, if standing is too challenging for you, then don't practice the exercises standing. If standing is too hard, practice, let me give you an example. One of those exercises was lifting my knee forward, like bringing it from the back position and bringing it up towards the ceiling. If that's too hard for you to do in a standing position, well then maybe you try it sitting down and you still march your leg. Or if that's still too challenging, maybe you try it sitting but reclined and you're marching your legs. Or maybe you try it laying on your side or laying on your back. So find a position that is doable for you. And ideally, obviously I'm a little biased because I'm a physical therapist, but ideally work with a PT because they can help you determine which is the most functional position. So if your goal is walking, the most functional position is going to be standing because it's the same position that you need to be in to actually walk. However, if that's too hard, the guidance that I always give is let's try all these positions, and I want you to do the exercise in the position that is easiest for you. Choosing the easiest position does not mean that you're cheating or you're taking the easy way out. By doing the exercise in the easiest position, you are going to be able to do more repetitions than if you were doing it in a harder position. And the more repetitions you do, you're going to be getting that neuroplasticity. So the way to get neuroplasticity to work is to do as many repetitions as you can with good quality over and over and over and over and over and over again, whether that's all in one sitting or throughout the day. So by choosing the easiest position, you'll be able to build up strength, build up that neural pathway, and then eventually you'll feel like, okay, this is definitely getting easier. Then we transition to a more functional position. So choose an exercise position that's doable for you. And if you need help doing that, a PT is one of the best people to help you figure that out. Okay, next slide. So newest guidelines. So doing aerobic exercise first has recently been shown in research to actually prime your brain for neuroplasticity. I will never forget, I found out this information when I was at the annual Consortium of Multiple Sclerosis Centers, or CMSC, meetings. And I remember sitting in my seat just watching this person present. And when they said that, I was like, oh my God, honestly, like neuroplasticity is amazing. The fact that it can happen for anyone with MS is amazing. But now you're telling me that there's something that we can do to actually make it more likely that neuroplasticity will kick in. I was just feeling so giddy sitting in that chair. So I was like, wow, this could be a game changer. Now, keep in mind, this research is still so new that we don't have any guidelines. So right now, there's no protocol. There's nothing that says, okay, do aerobic exercise at this intensity level for this many minutes, and then do your MS-specific functional exercises. There's nothing like that. So what I've been telling my clients is, do some type of cardio. Truly doesn't matter what it is. I actually have a preference to use your arms for cardio because some of you might resonate when I say this, but if you do cardio with your legs, you might fatigue yourself, so then you can't even do your functional exercises or your wellness exercises. So it's really important that you don't fatigue the muscle group that you're about to use. So you can do cardio by just, if you have maybe 1 or 2 pound hand weights or cans of tomato soup or something, you can hold on to those, but you don't need it. Even no weights, just pump your arms like this, punch your arms, just keep moving, go up, roll them like this, just keep moving for maybe 2 minutes, 3 minutes, 5 minutes. You will feel your heart rate increase even if you're not holding on to any weights. So do some type of aerobic exercise and then do your functional exercise or your wellness exercises. Functional exercise is the second bullet point. You guys know what that is now because we just described it, but there is so much research from the last several years, and even this year, even more research has been released that if you have a goal of improving function or activities, which to be honest, 99.9% of my clients do, which is why I've personally focused so heavily on functional exercise. So if you have a functional goal, functional exercise is what you have to do. Otherwise, you'll be that person that says, Dr. Gretchen, I feel stronger, but my walking's not any easier. Or I feel stronger, but it's still so hard to climb the stairs. Or, my balance is better, but I'm still falling all over the place when I walk. So you'll be feeling the benefits of the wellness exercises, but not the functional exercises. So again, it totally depends on your goal. Perfect quality is so important. Think about neuroplasticity again. If you have a goal of exercising to improve the neural pathways and improve your function, if you have poor quality with your movements, you are training your brain to have poor quality. For example, I'm going to stand up and demonstrate. Actually, if you can stop sharing this slide just so you can see me a little bit bigger. I think, again, a lot of people have a goal of walking better. So, for example, if I'm going to be doing the marching exercise like this, if I have bad quality, hold on, move this slightly down. If instead of having good quality like this, I'm doing this, and maybe I'm doing this in a seated position, it doesn't have to be standing, but if I practice a ton of times doing this, then guess what's going to happen when I walk forward? If I walk forward and this is the movement that I want, but this is the movement that I'm training, I'm going to trip over myself because I keep practicing this. And my legs, I'm either going to hit myself or I'm going to land in front of the other foot in a staggered stance, and then I'm going to fall over. So it's really important that the exercises that you do have good quality. And you can pull up that slide again. The next one was high repetitions. So you want lots and lots of repetitions because every time that you practice, literally every single repetition that you do is an opportunity for your brain to find that neural pathway, to either strengthen the pathway that exists or to reroute itself and find a different pathway. So high repetitions, and the last bullet point is so important, rest breaks. Take lots and lots of rest breaks because perfect quality or your best quality is going to take your energy. What I tell my clients, because I get this question a lot, is, well, how many reps and sets should I do? And what I'll say is to do as many repetitions in one set as you can with good, perfect quality. Then as soon as you notice fatigue or poor quality, just stop and rest. And then once you feel rested, maybe 30 seconds had passed, or maybe a minute or 5 minutes, doesn't matter how long your rest break is, then do it again. As many repetitions as you can with good quality, because you want as many repetitions, high repetitions, but good quality. So for most people, that might mean that your first set, let's just say, is 10 good quality repetitions. Then you rest. But your second set, you're a little bit more tired now because you've already done one set. So your second set might only be 7 repetitions. And then let's say you do a third set, but your third set is only 4 repetitions, which is good quality repetitions. So maybe you do a fifth set, and that's 2 repetitions. I honestly have some clients who just do 2 repetitions with good quality, but they do that a bunch throughout the day. And by the end of the day, they've done 20 repetitions. Not all at once, but that's okay. So they did 20, that's 20 opportunities for your brain to strengthen that pathway. Okay, we can go on to the next slide. I can get off on soapboxes on so many of these things. So newest guidelines as well. This is, I say dance is a newest guideline. I personally don't think it's brand new. There was a lot of research actually many years ago on the benefits of dance for people with neurological conditions, including multiple sclerosis, but it seems to be coming back around. So there's a lot of research recently on dance. And so they're looking at structured dance, like coordination dance, ballet, ballroom dancing. I actually did take ballroom dancing when I was in college. And one thing that I love doing with my clients is the foxtrot. I don't know if you guys know it at all, but I've been doing it with my clients for 7 years now, and it's so great because it works on balance and coordination, speed, ataxia, these uncoordinated movements. So it helps a lot physically, but also the recent research that they're doing has been in-person dance, and so that helps with isolation. It's so easy to isolate yourself when you have a disease that causes physical impairments or limitations. So going to a dance class helps with isolation. It gets you out there. It gets you communicating with other people. The second newest guideline, high intensity interval training. I hope that you guys have heard of this. It's not brand new, but it is newer. They're saying that high intensity interval training, basically get your heart rate up and then do something that lowers your heart rate. and then your heart rate up again, and then lowers your heart rate. So doing exercises like that, which truly anyone with MS can do. I know it might sound like high intensity interval training is just for people who are already strong, but truly anyone with MS, no matter what your physical abilities are, you can do it. And then the last one is a variable environment and distributed. So what I mean by this is doing your exercises in different environments, not always doing your exercises in your home office or on the same couch. You know, if you're practicing that sit to stand exercise like we were talking about, practice on your couch, practice on your toilet, practice from your car seat, practice from your kitchen chair, from your living room chair, from a bunch of different environments. And then lastly, what I mean by distributed is that it's equally as effective for you to exercise throughout the day. As I mentioned, one of my missing link members does 2 repetitions, but like 10 times throughout the day. So she's doing it distributed. And so by the end of the day, she's done 20. That's just as effective as doing 20 in one sitting. So do what works for you. If you're the type of person that you'd rather get all your exercises done at once, great, do that. If you feel like, oh, that's so daunting, I just don't even want to get started because I don't want to exercise for 30 minutes or an hour or 45 minutes, then just do one exercise and just you do it throughout the day. It's equally as effective. Okay, next slide, and I actually think that's my last slide. Yes, so how to get access. So in-person physical therapy is where you can learn all of this stuff. And if you're looking for an MS certified specialist, the MS Society has a page on their website called Care Partners. So that would be a great place to start. That is going to be a clinic that has MS certified specialists. However, it's not all encompassing. You actually have to apply to be a care partner through the MS Society. So one thing that I also put on here was call your local PT clinics, because you might not know, it might not be advertised anywhere, but if you call a local clinic and say, hey, do you have an MS specialized physical therapist? They might not be on any of the websites, not the MS Society Care Partner. Another one is the Consortium of MS Centers. So those are places and resources that you can look, but also just calling around and seeing. Telehealth physical therapy, I'm so excited to announce that it is still being done. Insurance has been all over the place with who's allowing telehealth PT and who isn't. And honestly, pre-COVID, it wasn't a thing. I tried to get the clinic I was working at like 4 years ago to do it, and it was just taboo. So one good thing that came out of COVID is telehealth physical therapy. So you can be able to do these functional PT guided exercises in your own home. And then the last one, just a small plug there. So my online program is The Missing Link, where I've recorded all of my favorite MS specific exercises for functional exercises. And there's other great goodies in there too. But so these are a lot of great options if you're looking for guidance. If you feel like, okay, I've got some things to do now because Dr. Gretchen told me in that presentation what to do and how to do it, but now I need guidance or support. These are some resources for you. Okay, next slide. All right, so we can go ahead and do the Q&A. If you guys do have any questions for me, I'm in my email inbox, what feels like all day. So my email is there if you do have any questions for me. My website, I just started a podcast. I have a Facebook group. I'm all over the internet. So those are some places where you can find me.
Awesome. Thank you very much. If you were in person, I'd give you a hug and shake your hand or whatever, but we're not doing that, so you'll have to take it virtually, okay? Thank you very, very much for that. All right, so we do have a lot of questions, and we have questions online. We have questions of people that wrote in first, so I'm going to start with those that came in from people when they registered. All right, so firstly, and you might have spoken about this, and I might have missed it, I'm sorry, but I'm going to ask you anyway. Can you please talk about staying fit when dependent on a wheelchair?
Oh, yeah, I did not talk about this. There's so many things, we are taught so many exercises when we're growing up that are just like really intense exercises. And we're also taught that seated exercises aren't as effective because no one's doing them. But if you are in a wheelchair or a scooter for most of your day, there's actually a good amount of exercises that you can do. For one, transferring is something that you're going to need to be able to do, and ideally being more independent in that can be really helpful for you, for your caregivers. So There's lots of different arm strengthening exercises. Going to our topic of the day, so wellness-based exercises might be something like bicep curls. I don't know, I'm doing both at the same time. It can be one arm or both alternating. Weights or no weights, bicep curls can be a good one. Punching overhead or overhead lifts, again, with or without weight. So lots of arm movements. A functional goal that's my favorite for anyone in a wheelchair. I can't demonstrate this super well because my chair doesn't have real armrests, but have your hands on the armrest and practice lifting yourself up and down and up and down. So that's a functional exercise, because if you're going to transfer anywhere, you got to be able to lift yourself up and down. So there's lots of exercises like that, not to mention leg exercises, seated marching, seated leg kicks, core exercises, sitting back and then pulling yourself up using your ab muscles. So there's a ton, but I hope those are a few examples for you.
Okay, thank you. I just want to answer some quick questions that people are asking about the presentation. One, Gretchen's presentation did not have slides. So if you want to watch this again, and again, you know, for everybody else, even with our other presenters, you're going to have to wait till we put this onto our YouTube channel, and then you can watch it again and see what you might have missed. All right, another person was asking about Wellness Mondays. All right, Wellness Mondays, you could go to our website, msviewsandnews.org, and in the center column, the list of different programs that are there for the month. Just visit them and click on those that you want to watch, and you'll get registered for those programs. Okay? All right, so next, we have the next question. What do you think of a pelvic physical therapist for bladder issues or incontinence?
Great question. I'm a huge advocate for pelvic floor physical therapists. Just as MS certified specialist physical therapists are different than orthopedic physical therapists, pelvic floor physical therapy is something completely different. There's a certification and specialization for them as well. I think everyone should go to a pelvic floor PT because, I mean, a lot of us are told from a young age, Kegels are great for everyone, but they're actually not. They're great for tightening the pelvic floor, but some people have too tight of a pelvic floor, so they actually need to focus on strategies to relax. And then we let MS come into play as well, and that has a whole nother slew of types of neurogenic bladder, urinary frequency, incontinence, all of that, and bowel too. So yes, I'm a huge advocate for pelvic floor physical therapy.
Great, thank you. So adding to what you just, or going further with what you were just talking about, you talk about Kegels for women. What is it done for men?
Men can also do Kegels. It's the same type of contraction to tighten the pelvic floor. So not all women should do them, not all men should do them, but if you do have any type of weakness in the pelvic floor, and that might be causing some of your urinary or bowel incontinence or urgency, frequency, all that good stuff, then Kegel is one of the simplest exercises, but you can make it functional. So if you're doing it lying down, you can get a really strong pelvic floor while lying down, but you go to sit or stand up and your pelvic floor is weak again. So similar to what we've been talking about today, initially, pelvic floor exercises, Kegels, are easiest lying down because you don't have to worry about gravity. But then once that becomes easier, practice doing Kegels sitting. Then practice doing them standing, because ideally, you want to use that pelvic floor strength when you're standing so that you don't leak, or even sitting. So it's important to practice that exercise sitting and standing.
Thank you. All right, next, can you please discuss movement and multiple sclerosis?
Yes, that is very broad. I'm not sure where to start with that movement. I guess I can say, if there's a specific question, let me know, but just generally speaking, movement is necessary. I became an MS specialist I think about 6 years ago now, it might be close to 7, but regardless, even back then, that wasn't that long ago, but back then, 6 or 7 years ago, there were still some neurologists who didn't know the benefits of physical therapy and exercise, and they just thought that exercise is something that will cause your core temperature to rise and therefore you'll get heat intolerance. Or exercise is something that will cause fatigue. It's something that will cause something negative. So they actually told their clients not to exercise, but now so much research is disproving that. And so doing some type of movement, whatever that means for you. Today we talked about MS specific wellness and functional exercises, but let's not exclude yoga classes, Tai Chi, swimming, or just getting in the pool and doing some of your exercises there. Any movement is better than no movement. So do something that you enjoy because you'll stay consistent with that. Consistency is the most important.
Great. Thank you very much. How do you find a pelvic floor physical therapist?
There is a website. I actually think I could probably find it in 20 seconds. But there is a resource online that you can go to. The American Physical Therapy Association, the APTA, is one place that you can go to find any sort of specialist. It could be an MS, neurological, pelvic floor. But I do have a friend, maybe I'll just email it to Stu later on and you guys can post it in the comments or something.
Great.
But there are some resources. So the website too, so one of my friends is a pelvic floor physical therapist. So I asked her once, what is a resource to find them? There's a website called pelvicguru.com, Guru. So you can go there and find one too.
Okay, great. I'll post that up in a minute, okay, as well, so that way they can see it and copy it to themselves. Okay. All right. Next, we have a person asking, what are the best physical therapy treatments for a patient with MS and scoliosis that has mobility issues with pain?
I love this question. I'm actually surprised that I forgot to put this in my presentation. So I get this question on a daily basis of what's the best exercise or what's the best treatment? And when it comes to physical therapy and exercise, my response is first, well, what is the goal you're working towards? What is something that you want to be easier? And then whatever your answer is, I'll say, okay, let's break that down into functional exercises. So there is no, unfortunately, I know this is the answer that no one wants to hear, but I don't think there's any one best exercise, because if someone's working on standing up strong or sitting down without plopping, the best exercise for them is completely different than someone who's working on walking better. And that's completely different than if someone's main goal is stair climbing. So there's no one best exercise. My answer is, what is the one biggest goal that you're working towards, or something that you really, really want to improve, and write that down. And then hopefully with the education that you got today, you can start to think, okay, what are the separate movements that I need to do in order to do that? Like the walking. In order for me to walk forward, there are those 7 things. So you can try to do it on your own. If not, again, reach out to me. There's physical therapists in your area. There's resources, but break it down. Those are the best exercises for you.
Okay, thank you. So next, and I'm going to probably add to this even after you talk about it, but a person is asking, what exercise would Gretchen suggest for lifting a leg up independently when getting into the car, for example?
The exercise is practicing lifting your leg up. So it might sound too simple, not that it's easy, but it might sound simple, but that the most functional way to improve your leg lifting up is to practice lifting your leg up. And now what some people might be thinking right now is, but I try to do that and it doesn't lift at all. And that's normal, unfortunately, for a lot of people with MS. And what I want to share with you here is keep trying, even if you literally have 0 movement. Just the other day, so in the missing link, we have a Facebook group that we just use for accountability. And someone posted yesterday, she is foot drop. And one of my favorite exercises for foot drop is just lifting your foot, doing the exact movement that's hard for you to do. So for this person that just asked the question, lifting your knee, since that's the movement that you need to do. And anyways, she had said back when she started the program, she literally couldn't lift her foot at all. And now she can, little bit. It's not miraculous, doesn't go from lifting not at all to a ton, but she's starting to notice some improvements. Now, if you think about it, if she had not done that exercise, most people who have 0 movement think, well, I can't do it, what's next? But if you keep practicing, your brain, with every repetition, even if there's no movement, your brain is trying to find a way to make that movement happen. So in her case, and plenty of other cases, it works. Just keep practicing. I know it seems weird to do a movement that do an exercise that has no movement, but think of it as a brain exercise. So for this person asking about lifting your leg, practice lifting your leg just from a chair, from a seated position, since when you're in your car, you're in a seated position.
Right. Thank you for that. Okay. So what I was going to say that, I can lift my leg up when getting in the car, but sometimes it's too painful for me to do that. So I turn my body so that my butt goes down first, and then I just turn inward. All right. And so that's something that you all could do as well if you're having that much of a problem getting in the car. Okay.
That's a perfect example. So one thing that I said back in the beginning was, as PTs, we focus on neuro recovery, neuroplasticity, which would mean the exercise that I just said, lifting your leg up. But the other thing is compensation exercises, or compensation strategies. So making it easier, leaning back, tightening your core, just straightening your knee and scooting it in. So there's other ways to do it, whether you're focusing on compensation or neuroplasticity.
Right. Thank you for that. All right. Person wants to know about dance therapy. I mean, she says she loves dance therapy. And is there any place that you know of to do ballroom dance for people with MS, I guess? Is there anything online maybe?
I personally don't know of any. I'm sure there are a few resources, if not several, online. And I think that there are active clinical studies being done on it. So you could even go to clinicaltrials.gov and see if there is anything that you could participate in there. Or the best thing is probably do a quick Google search and then call around to your local gyms or like YMCAs and see if there are any programs near you. But I don't know of any myself.
Okay, thank you. Next, how to best exercise for secondary progressive MS, or how to overcome cerebral ataxia.
So I actually just posted a YouTube video all about ataxia, because Ataxia Awareness Month or Day, I think it was in October. Now I'm forgetting the day. Anyways, it was recent. And so I posted a YouTube video on, I think I shared like 7 different exercises for ataxia, so you can check that out. But the best exercises for any type of MS, relapsing remitting, primary progressive, secondary progressive, is all what we talked about today. That's the beauty of MS-specific exercises and physical therapy. It doesn't matter where you're at in your journey with MS. You could be just diagnosed. You could be diagnosed for 40 years now. You could be still walking and running. You could be in a wheelchair or anywhere in between. It's still the same concepts, which I think that's great. It's not like there's all these tricky little nuances. And if you have secondary progressive, well, then you do this. But if you have primary or relapsing remitting, then you do this. It's all the same. It's all based on function and your goals. Cerebral ataxia is when there's ataxia that affects your coordination, your balance, and therefore you might be walking forward, but you kind of look like you're drunk, or you do lose your balance and fall, or you go to stand up, and you can't just walk right away. You stand up and you just need to pause, wait a second, and then move. So there's some exercises again on YouTube that you can actually see me doing, but some other strategies are take a second. So basically, don't stand up and try to move right away. Stand up, take a second, and then move. If you try to move too quickly, that's going to make it worse. Also, just doing one thing at a time. So, which doing 2 things at a time is often hard for MS as well, but just do one thing at a time. Walk without talking to anyone, or clean the counters without listening to the TV. So just doing one thing at a time is another strategy that can help with that.
Great, thank you for that. We have just 9 minutes remaining, okay? So I'm going to zip through some questions here. Hopefully you could zip through some of the answers and we'll get going, all right? Can you please demonstrate an exercise for kickback phase of walking?
So yes, I'll demonstrate right now, but keep in mind whichever movement you're looking to improve. So in this question, it's the kickback, so I'll demonstrate that, but it's the exact movement that you would practice as an exercise. And if it's too hard, you break it down. So the kickback, back up here. All right, see if that works. Oh, you can't see my head. All right, we'll try that. So For the kickback, I think what this person means is this. I'm in the middle of a room. You absolutely can use a walker, a cane, trekking poles, rollator, anything. You can use something like that. So you can imagine that I'm using that here. So the one exercise is just simply literally practice that same movement. Again, even if there's no movement. So I might try to bend my leg and maybe it just does this. It's the slightest movement, but that's good. Still practice that. You're still getting that neural pathway from your brain down to your hamstrings. So just work towards this movement. It doesn't need to be big, but just that's one version. If you can't, I can't really demonstrate here, but if that's too challenging, as I mentioned in the presentation, you can try seated. So if you think about it, when I'm standing and doing that, all I'm doing is I'm standing and I'm bending my knee. I'm trying to get my heel closer to my butt. So if that position is too challenging, you're sitting. So I'm assuming all of you guys are sitting right now. So you're sitting, bend your knee. And when you bend your knee, your heel comes closer to your butt. And so that's a seated version. If you're lying on your side, bend your knee. So no matter what position you're in, you're practicing bending your knee. So I hope that's helpful.
Okay, great. Thank you for that. Yes, the person has already written back how helpful your answer was. So that's fabulous. Okay. All right. I love the interactive, even by text messaging. Okay. It's pretty cool. All right. Next, can exercise be broken down into short sessions each day rather than one long session? And how much exercise should one do to feel like they're actually exercising? Do they need to get their heart rate up and jumping all over? How aerobic should they be? I'm combining questions now.
Okay, so first part of the question, yes, as I mentioned at the end of my presentation, you can do your exercises all at once or distributed throughout the day. Research shows both are effective, so you can choose whichever is best for you and your lifestyle. Second question, you don't have to get your heart rate up while you're exercising. If you do, great, you're also working on cardio, but it's not necessary. If your goal is cardio, then yes, get your heart rate up. But if your goal is strengthening, your heart rate might not increase, especially if you're taking lots of rest breaks like you should be. So take rest breaks. And does that answer that question?
I believe so.
I feel like there was something else.
About the aerobic portion of it, should they be getting, well, you did answer about getting their heart rate up and not necessary to do that. So.
Right. Oh, intensity. That's what I was going to say. Research right now is saying that the ideal number of minutes that you exercise a week is 150 minutes. So that's going to depend. It's going to be different for everyone based on how many days you want to exercise. If you want to exercise 5 days, that's going to be different, a certain number of minutes per day, than if you only exercise 3 days. So, but the general number out there in the neurosphere right now is shoot for 150 minutes a week.
Great, thank you. We have 5 minutes. I've got at least 6 questions. Okay, you ready?
Ready.
Is remote PT helpful for MS patients?
Yes, there was actually an article, I think it was published by the MS Association of America a few years ago, saying it was a trial with remote PT, remote rehab, and it found it to be effective. And there's so much that you can do. A lot of it is demonstrating and looking at you and being able to pick apart, okay, what muscle movements shouldn't be happening versus should be happening. So it can be done remotely. The only thing you can't do remotely is hands-on stuff, but with MS, sometimes that doesn't include hands-on stuff.
Thank you. Several people are asking where they can get online where they could learn more about physical therapists, online therapy, things to do with actually typing in probably to Google search and saying, hey, physical therapists, where can I find you, right? What do you suggest for everybody, please?
Yeah, so there's a ton of, well, it depends what you're looking for. If you're looking to work one-on-one with a physical therapist, you should know that that person needs to live in your state. So physical therapists can be licensed in individual states, and you can only treat people in that state. So if you are Googling for a physical therapist that's MS specialist, just know they have to live in the state that you're living in. If you're looking for just resources, There's a lot online. I mean, just I know myself, I'm on YouTube, Instagram, Facebook. There's others out there as well. So, YouTube is a great place. I'm a very visual learner, so then you can actually see the exercises versus written in an article. But there's so many different MSPTs out there that are typing things up and sharing.
Great, thank you for that. Next, a person is writing about yoga. What do you feel about yoga for yoga practice? Please advise how a consistent intermediate yoga practice ties into all the helpful advice you're speaking about.
Great question. So, yeah, some people think like, okay, I'll just do my MS specific exercise, but I also do yoga and I also like to go to the pool and how do I integrate all of that? It's totally up to you. If you love doing yoga and you go 3 times a week, keep doing that. I wouldn't want you to stop doing that just because we're talking about MS specific exercises. I would say if your body can tolerate it, maybe 2 days a week, you do the MS specific things. The thing about yoga, I love yoga for so many reasons. It's typically not focusing on one muscle group at a time, meaning if you're holding a pose, many muscle groups are working. And when you do that, it's easy for the stronger muscle groups to overcompensate. So your weaker muscle groups aren't getting as strong. So that's why I'm a huge advocate for the MS specific exercises. They focus on one muscle group at a time, but you can absolutely integrate other things too. You can do MS specific yoga, gym, pool. So that's my answer.
Great. Thank you for that. People are asking how to get your information. All right. And I'm going to let everybody know again. In the journal that we have as a handout, all right, which is on the toolbar on the right side of the page, if you click on the handouts, there's a list of exhibitors and their resources. Okay. Their resource. This is the exhibitor resource page. It has our exhibitors. It has our supporters. It has like the missing link, which is what Gretchen's program is, and it has about the Boston MS Center, Neurology Center in Maitland, Florida. So you can find all of that there, right? And then I don't have to keep typing in everything individually. Okay, great. And that's why we have the journal, by the way, so you can see what this is about. All right, so a lot of people are saying thank you. We have less than a minute. I'm not going to ask any more questions. There are too many kudos out there to give you from so many people that have been online. And I'm just going to say that to you and say thank you. Thank you very much, Gretchen.